Cancer occurs in the body when there has been a mutation in a cell's genetic coding, or DNA. As we age, our cells are continuously creating new cells to replace the old ones and to allow our bodies to grow. As the replication occurs, the DNA is constantly resequenced in order to allow the body to form various different types of cells: muscle, blood, bone, heart, and more. But as the DNA is rearranged, it is easily able to acquire a driver mutation. This means that within the DNA, an inactive oncogene becomes activated or an active tumor suppressor gene becomes deactivated. This mutation sends a now cancerous cell into an uncontrolled and fatal frenzy, with only two things it knows how to do: divide and survive at all costs. Because cancer is caused by a genetic mutation, it is possible that a human's acquired immune system will be able to recognize the cell and respond to it. First, a now cancerous cell will begin to display mutated proteins on its major histamine complexes found on the surface of the cell. The once healthy cell is now considered an APC, or antigen-presenting cell, and will eventually encounter a naive T cell roaming throughout the body. The T cell and APC will bind together, initiating the release of interleukins that notify the T cell to activate an immune response against the cancer. Cytokines will tell the naive T cells to proliferate into cytotoxic T cells and memory T cells. The cytotoxic T cells will work to eradicate all cancerous cells, portraying the mutated proteins on their MHCs through apoptosis, while the memory T cells will record how to effectively fight the cancer for future reference. Despite the immune system's ability to identify a cancerous cell, there are many factors that allow a cancer cell to evade detection. As our bodies age, the immune system's ability to detect friend from foe weakens, disabling B and T lymphocytes from recognizing a cancer cell. But before the body begins to lose this ability, cancer cells still have their methods for evading detection. Often, cancer cells have selectively chosen mutations that allow the proteins presented to be unidentifiable as mutated. Cancer cells may also secrete immunosuppressive cytokines to inhibit an immune response. A natural immune response to cancer is considered normal, but because of the nature of malignant tumors, often an immune response must be artificially enhanced and provoked. The stronger immune response may be considered abnormal. Such responses are evoked in many different ways. Common immunotherapies include the use of T cells, cytokines, MAB, oncolytic viruses, and therapeutic cancer vaccines. The body's immune response to cancer is considered temporary, as most patients will seek treatment and hopefully be able to eradicate the cancer. But because of cancer's tendency to come back, the immune response could also be considered recurring. Symptoms of a natural immune response to cancer are often mild or non-existent. However, symptoms of some form of immunotherapy cancer treatment can be severe, especially if the treatment has been paired with traditional forms of cancer treatment, such as radiation and chemotherapy. Symptoms of the disease itself vary based on the location of the tumor. A tumor rising in the bone or muscle will cause dramatically different symptoms than one in the brain or lungs. However, some common symptoms for all types of cancer are fatigue, headaches, bone or muscle pain, nausea, vomiting, and more. The prognosis of someone diagnosed with cancer varies dramatically based on the type, location, and stage of the cancer. Because of cancer's ability to metastasize, even what may be considered a low-risk cancer can turn fatal if it manages to spread. Cancer is typically divided into 4 stages, with each stage continuously indicating a more severe form of the cancer and a diminished chance of survival.